Thank you for joining us on Coffee Break, brought to you by the Middle Alabama Area Agency on Aging, or M4A. M4A is a part of a network of 13 area agencies on aging that cover all 67 counties across the state. We are located in Alabaster, and we cover Blount, Chilton, Shelby, St. Clair, and Walker counties. We would love to find out how we can help your family today. For previous episodes of Coffee Break, feel free to check out our YouTube channel. We want to thank everybody who has been a supporter of the Coffee Break. And if this is your first time, welcome. Or if this is your first time catching one of the videos on our Facebook stream, welcome as well. We are hosting this primarily on our Zoom account live. And then, of course, we're sharing it on our Facebook account live as well. But we will be recording this. So for anybody that's joining us later or getting to this video later, we will have this trimmed up and recorded and put on our YouTube channel as well, so that if you have a need to play it back or to share it with any of your friends or family or colleagues, feel free to do so. Just to give you kind of a little bit of a background on Coffee Break, it's traditionally, we created this program to be a brief respite for caregivers provided by the Middle Alabama Area Agency on Aging, or M4A, as you see there on the screen. However, we are always welcome to have both professionals and individuals in the community who find that these are helpful, but we do encourage, if you know of any caregivers that you work with or that you know that you're kin to or are friends with, we do ask that you share this with them so that we can hopefully give them a little bit of respite relief, as well as help to improve their quality of life with our new normal virtual way of reaching everyone. So thanks again. Again, this is Coffee Break. This is session 10. This is set up in a webinar style format. So only the panelists that we will have 4 on today. We're the only ones that are allowed to talk because of HIPAA compliance. So if you have any questions, feel free. We have a Q&A box as well as a chat window. You can, if you're in the Zoom itself, you can drop questions in there, and we'll answer them towards the end of the presentation from our guest speaker today, as well as if you're on Facebook, of course, you can post those under the video, the live stream, and we can ask the panelists those questions as well. So Coffee Break, again, is brought to you by, let's see if I can get my thing to change here. It is brought to you by our PANDA project and our Alabama Cares Caregiver Support Program. It's a collaborative effort between the two. Alabama Cares covers all 5 counties for our region that we cover, which we'll go over towards the end of this presentation as well. And the PANDA project is a new initiative that we've received grant monies for to provide Alzheimer's and dementia assistance specifically for the Shelby County region in Alabama. So both of these programs do a wonderful job and a lot to serve caregivers across our service area. So it is a collaborative effort between the two. Today's speaker, we have Ms. Lisa Holman, who is the Director of Programs for the Alzheimer's Association Alabama chapter. So I'm going to pass it on to Ms. Lisa and let her kind of introduce herself and go ahead and begin her presentation. Lisa?
Hi, thank you so much. Want to thank Jeremy and Jennifer both for asking me to speak today. And what I want to do is just kind of give you just a brief update really on what's kind of going on in the advocacy world that we are working on right now, some of our priorities. And then also we had our Alzheimer's Association International Conference just a couple of weeks ago, the last week of July. So I just wanted to give you just a couple of highlights from there. I will preface this with, I am not a scientist by any stretch of the imagination, but I'll just try to give you the highlights and then point you in the direction where you can get much more detailed and specific information if you would like that. All right, so I probably don't have to tell any of you this, but that, what a huge crisis, public health crisis Alzheimer's disease is, and all dementias. We know that more than 5 million Americans are living with Alzheimer's right now. In the United States, there are more than 16 million Americans who provide unpaid care for people with Alzheimer's or other dementias. And I will have to say, probably right before COVID, Alzheimer's was the most expensive disease in America, and projected that by the year 2050, costs could be as high as $1 trillion, over $1 trillion. So this is more, this is just Alabama statistics. It's a lot of numbers on there, and I can send it out. I can get it to Jennifer and Jeremy to get to you guys if you would like it. But really, I want to point out one statistic on there that every time I show this, it's the one that everybody's like, oh my goodness. But Alabama this year, or in 2020, has the highest death rate from Alzheimer's in the United States. So for the last several years, we've always kind of been in that top 5, but this year we had the highest in the country. Okay, next slide. And just the Alzheimer's Association, we are a voluntary health organization dedicated to Alzheimer's care, support, and research. And our vision is really a world without Alzheimer's and all other dementias. If you ever wondered where our logo came from, you can kind of see it there. It's all about people and brains and the beaker. So the brain and science. Okay. So I am a very just visual person. I'm not very artistic, so please forgive this slide that I put together. But being very visual, I just think it's easier to kind of explain kind of what the association does, because we kind of work on 2 different fronts. So if you look on the left side of the screen, you see that people going through the Alzheimer's journey, I mean, it is an uphill battle. And so we want to be there to help those families who are on that journey, to help them up that mountain. And we do that through either one-to-one programs and services, or one-to-few. So things like we have a 24/7 helpline that is staffed with master's level clinicians, 365 days a year. So if someone it's 2 o'clock in the morning and they're just up, can't sleep at night, or maybe they're in the middle of something right then, a situation, but they are able to call and be connected with those master's level clinicians at any time, day or night. They also do care consultations, so more kind of some care planning sessions. So those are kind of some of the one-on-one services. And then we also do support groups and education programs and early stage programs that are more kind of fall into the category of that one-to-few. So go back just a little bit. So on the right side of the screen is kind of the other side, I guess, of the Alzheimer's Association, where it's really one to the masses. So where we are really trying to change things for everybody in the state, in the country, and hopefully in the world. And so we try to do that by we want to try to cut that mountain down. So if we can make that mountain so it's not such an uphill battle, then that would be great. So we do that a lot through research and through public policy, both on the federal and the state level, and then through some health systems work that we have begun doing just with regulations and things like that. Okay, next slide. Okay, and you can go on to the next. So some of our advocacy efforts. A couple of months ago, with we put out to Congress and also to state leadership just these recommendations and telling them that there is an urgent need in these long-term care facilities for residents and staff. And it really, what we were asking for really addressed 4 different things. So it was testing, reporting, so that that it was reported immediately and accurately, that as hotspots occurred, that the facility would be provided the needed support that they had, and that they would have all of the PPE that they needed and the testing equipment and training and things like that. So something that we have just, to kind of take this to a next step, and you can go to the next screen, Jeremy, that we have started just this week, really, is that we are asking, we're doing a 50 states campaign, basically. So on the federal policy issues that we push, we always have the same voice. But sometimes on the state, what we're pushing for in different states is different from state to state, just depending on what's going on in that area, in that community. But this week, we are all addressing the governors in every state, and on the same thing. And that is just that they must, the urgent need for them to act and make available to every long-term care community these rapid point of care testing. And, we see that this is with family members and not being able to go in and visit their loved ones in these long-term care facilities, that social isolation is really contributed to some individual decline and stress. So the only way really to end that social isolation is to ensure that every long-term care community has access to this rapid testing for all residents, all staff, all visitors, and that it's access for every time they come into the facility. And these rapid point of care tests actually only take about 15 to 20 minutes for them to get the results back. So we have, and I'll have my email at the end of this, and I can send you the link, but we, on all of our public policy issues, we really try to make it easy for as many voices to be heard as we can, and we want to make it easy for all of you guys. So it really is, I can send you this link, you click on the link, and you put in your name and your address, and it sends an email to Governor Ivey. You can put in your, little paragraph about your personal story if you would like, but you don't have to. The rest of the email is already there. So it's really just a click of the button. But we, if the governors all across the country are hearing all of this, all these voices at one time, we really hope that they will take action and act on this. Okay, next slide. So this is just one of the federal priorities that we are working on right now, and this is the Promoting Alzheimer's Awareness to Prevent Elder Abuse Act. And basically what this is it would require the Department of Justice to have developed training materials that would help first responders and people in the justice system who would help them better able to support victims of abuse who are living with Alzheimer's and other dementias. So we just want to improve the quality of their interactions, with people with Alzheimer's or dementia. Right now, that has it unanimously passed the Senate, and we are now starting to work on getting it through the House. So. And again, at the end of the presentation, I've got my email on there. And if you send me an email, I can send you also the link to where you can be alerted anytime we have any kind of policy issue that we really it really makes such an impact and such a huge difference when we can have as many voices weigh in to our congressmen and to our state leaders as well. So we would love to get all of you involved in that. So this is just one of our really, I'm super proud. It's a big success, I think, and something that we push for every year. But research funding for Alzheimer's disease to the National Institutes of Health, you can see back in 2011, they only got $448 million a year. And in the last 5 years, we have consistently really advocated for about a $350 million increase every year. And it's been, as you can see, it has been pretty successful. And so this year it was up to, NIH gets $2.8 billion a year for Alzheimer's research. And so we just, think that's a fantastic thing. And one of the things that allows for too is back when, if you look at, it was only 448 million. A lot of times they weren't able to fund some of the more innovative ideas that, may have been kind of more out of the box kind of thing. They really stuck to, some of the mainstream kind of ideas at that time. But at this level, and when we keep asking for more increases as well, then they're able to fund a lot more diverse kinds of research projects. And so we think that's just fantastic. Okay, next slide. And so again, I kind of just covered this, but we are asking again for about a $350 million increase for fiscal year 21. So this is just a screenshot, but it's an app that you can download on your smartphone. If you just go in and search for Alzheimer's Impact Movement, you can stay up to date. It'll have different action alerts on there. You can kind of search what the policy priorities are at that time, kind of where they are in the process. So it's a great resource, and I would encourage all of you to go and download that from the App Store. So also, I just wanted to talk to you a little bit about how exciting of a time it is really right now in research. And like I mentioned, the last week of July, we held our AAIC conference, and typically that conference has about 6,000 researchers that attend it from all across the world. I think it's usually from about 60 different countries, and it's the largest convening of Alzheimer's researchers in the world. A couple of years ago, it was in Chicago, and I actually had a chance to go to it, and it was just, a lot of it, or most of it, I would say, it was way over my head, but it was amazing to be sitting in a room with 6,000 people that you knew they are looking for the cure or the treatment, so that we can find that first survivor of Alzheimer's. Well, this year it was supposed to be in the Netherlands, but because of COVID, it had to go virtual, and ended up with it being virtual. There were 33,000 attendees that were able to participate in it, and they represented over 160 countries. And so when they were telling us that on one of our staff webinars, I'm not exactly sure how many countries there are, but I don't think it's that many more than 160, maybe close to 200. So I just thought that was incredible. Again, I am not a scientist, but I'll tell you just some of the highlights and then kind of give you to where you can go and find more information on that. So you go to the next slide, Jeremy. So one of the things, and you may have seen this in the news, because there were several big stories about it, was these biomarkers, that they are just game changers. And there was some studies on different blood tests, several different blood tests that are looking promising to really being able to detect. It's called, it's a form of tau, but it's called p-tau217. And these blood tests they are finding are being able to detect that, so that they are, and more research is still needed, but it's just very promising. And what we are hoping is that we can have some kind of very, a blood test or a saliva test, something that is much less invasive than some of the, ways we have to diagnose Alzheimer's right now. But if we can, if they can get that test that's just easy and can be done in, you know, say in a doctor's office, just whenever you go, kind of just like you know, if we could get it to where it's like getting a cholesterol test, then that would just be game changing. And they're also, what they were talking about too, is that, and of course, we've seen other studies that show that the amyloid and tau tangles, so kind of the markers of Alzheimer's in the brain, that they believe they are really in the brain up to 20 years before people actually start showing the symptoms of dementia. And so if we could detect that way early in the game, then, and there's also some studies going on that I'll talk about lifestyle changes that hopefully we can do a lot of some modifiable lifestyle changes that would lower our risk for actually developing the symptoms of dementia. Okay, next screen. Okay, next screen. I'm sorry, I went ahead and covered that one. So, and they talked a lot about this, and this is just kind of in the Alzheimer's world, but they really believe that a future Alzheimer's therapy is going to be a combination of both lifestyle interventions and medicines. And the medicines, you know, kind of those can be on attacking different things, you know, some that that really maybe attack the amyloid and tau. There's a couple right now. One is called aducanumab, and it is it's a drug that has shown results to attack that amyloid. So if we could get to that amyloid before the symptoms of dementia start showing, that would be, you know, a fantastic thing. Well, that aducanumab is actually, it's gone through all 3 phases, and it's actually at the FDA now, and just it's going through their review process. So we don't know what's going to happen with it, but we are eager, you know, to hear what the FDA says about that. There's another drug that also kind of attacks that amyloid, and it's called BAN 2401, and I believe it's in its 3rd phase right now. So, but there are lots of different research, you know, research projects going right now and clinical trials going. So it just, I'm so hopeful. You know, I will say I have Alzheimer's in my family. I lost my grandmother to that, and so I'm super interested in the research and the science of it. And so it's just very exciting to me, and I think just some exciting things are going to happen in the next little bit. So one of these, one big trial, and the Alzheimer's Association is leading this, that they are doing. It's called the U.S. Pointer Study, and it's part of a more of a global study that's called it's the Fingers Study, that it's taken place around the world. But this is a clinical trial that's looking at some lifestyle groups, and you can get the next slide, Jeremy. I think it's yeah. So there's 2,000 participants in it. I think it's at 5 different locations across the country, and there's a self-guided group, and then there's one that it's more of a structured group. And what they are doing is really monitoring and looking at physical activity, nutrition, cognitive stimulation, and then health coaching. And so, you know, this, again, we think that, you know, we are learning that what is good for the heart is good for the brain. And so, you know, if things like eating healthy and just the way we kind of take care of our heart, if that's also good for the brain, then, you know, making those modifications to our lifestyle to try and lower our risk for Alzheimer's and dementia. So that one's still going on. This shows you, it tells you that it was is part of the worldwide finger study that is global, and so it's going on in all of these countries. Some of the other things they're looking at are different drugs that just to treat some of the behavioral and psychological symptoms. One in particular, and I couldn't find the name of it, but I will look for it and get it to you guys, that I sat in on at the AAIC, was one that really seemed to be working for agitation. And so, you know, again, lots more research needs to be done, but it's just a lot of these studies are just super promising. So we're excited to see what happens with all of them. A couple of, well, and I don't think I have a slide on this, but just a couple of the other big thing that they talked about a lot at AAIC was the flu and pneumonia vaccinations. And there were some studies that have shown that people over 60 years old that get both the flu and the pneumonia vaccine for several years in a row. There was one study, it said that they saw a 40% decrease in risk for mild cognitive impairment with that. And with the flu vaccine only, it was a 17% decrease in risk for MCI. So again, that's just one of the studies that they were really talking about a lot there. The Sprint Mind study is something that was released actually about a year ago, I think, and it is actually a proven thing that keeping our blood pressure under that systolic pressure of that top number at 120 or below, that significantly lowers our risk for mild cognitive impairment. And anyone that goes through, you know, it's on a continuum, and from mild cognitive impairment, you know, through to dementia. So anyone who has dementia has passed through that mild cognitive impairment phase. So if we can reduce the risk of even going through MCI, then of course we reduce the risk for dementia. This is a way that we can all be involved in research. Clinical trials are always looking for, you know, participants. They can't do their research without participants. And we have basically a kind of a matching service. It's called TrialMatch. And it has over 300 studies across the nation that you can take this. It's just, you answer this little questionnaire. I think it's about a 10-question questionnaire. And then that does not sign you up for any study, but that will tell you if you, any of the studies that you would qualify for that are either online or that are in your area. And then you can kind of read more about those studies and decide if that's something you want to do. They are looking for people who have dementia and are, you know, showing signs and have Alzheimer's. They are looking for caregivers, people who have a family history of Alzheimer's but are not showing any symptoms, and then also just healthy volunteers. So there's really kind of a place for everybody to participate in research if you would like. So another app that you can download, we have our Advocacy app, but another one is our Science Hub app. And so if you just go in your app store and search for Alzheimer's Association Science Hub, you will, you'll find this. And on this, it will give you, you can go on it to get kind of just the latest in the latest news, press releases that are coming out, or you can go on and just search if you wanted to, you know, search a certain study or a certain drug or, you know, the agitation or, you know, a certain symptom like that, you could be able to do that. So I would encourage all of you to download that as well.
So does anybody have any questions for Miss Lisa?
And again, too, if you email me, I can send you a couple of different links that we would love for you to participate in the campaign where we're addressing Governor Ivey, you know, this week. I can also send you the link just so you don't have to kind of go through our website, which our website is great. I would encourage all of you to go on alz.org. It's full of tons of different resources, but I can send you just some specific links to get to kind of some of the things that I talked about today.
Great. And Jennifer did just put that in the chat window, so everyone should have access to that. Again, it's LHOLMAN, L Holman at alz.org. Their Alzheimer's Association is just a wealth of knowledge surrounding dementia and Alzheimer's as a whole. And I know that, you know, for those of you who are eager to kind of keep up with statistics and things that are going on, you won't be disappointed with following their group, both nationally and on the state level. I don't think you mentioned this, Lisa, but I will put a plug in there for you for your support groups. I know that you had said that you guys do host support groups, but even for those that are in the community who are interested in being a host site for support groups, the Alzheimer's Association actually, they have a campaign that you can actually go through and be trained to be one of their host sites. I believe one of those is actually listening in as one of the attendees. So if you have, you know, a faith-based organization or a group that you're interested in across the state of Alabama, please contact them, because that could be something that you guys could do going forward to help your own communities as well. So,
oh, thank you for that, Jeremy. Yeah,
no
that's
problem.
great. And we also have, as well as support group facilitator training, we also have community educator training, where we will train volunteers to go out into their community and do presentations. Right now, of course, everything that we do is done virtually, but we do have support groups meeting virtually. We have education programs being done virtually. So still offering all those programs and services, but just in a safe way for our population right now.
Great. Well, I don't see any comments in the Q&A or in the chat window, with the exception of your email. Jennifer, do you see anything on the Facebook feed that we need to mention?
No, not right now.
Okay, great. So again, we'll be, you know, editing this video and posting it on all of our social medias, primarily our YouTube and Facebook accounts, but we will also include this in our newsletters for our participants who receive those. So just be on the lookout for it if you need to refer back to this video. And again, if you think of a question later, I mean, the Alzheimer's Association is just like any other organization that thrives off of trying to get information, both from legislators as well as the community. I mean, they thrive off of trying to be advocates for community members. So the more information, more questions that they're asked, you know, the better that they can, you know, do their job in a better version and try to get the answers that we all know that are so desperately needed throughout our communities. So feel free to reach out to their organization. They have a pretty active Facebook account as well. I believe they're on Instagram or everywhere. So feel free to like and share their pages to learn and stay up to date on everything that they have going on. All right, so Crystal, are you ready to take it over from here?
Sure.
All right, so up next we've got, if you were with us last week, you remember Miss Crystal Whitehead, who is our caregiver interventionist for M4A with our Alabama Cares program, and she's got some more information she's going to provide to us today. So I'm going to stop sharing my screen, Crystal, if you want to take it over from there.
Okay. So we're going to start with a little bit of a clip. One of the big resources that M4A has invested in is actually a program called Truealta. It is an online learning platform for caregivers. It focuses specifically on dementia and Alzheimer's related dementia. That was reverse. It focuses specifically on Alzheimer's and other dementia-related challenges and behaviors that caregivers face. So what we're going to do a little bit of a clip here. This is going to go into some details that Lisa has worked on. Can you hear audio?
What
Crystal.
you're looking at here are autopsy brains. So these are real brains. These come from the University of Alabama, work done by Dr. Richard Powers. And he convinced families to donate brains after people died so we could learn. Okay, and what you're looking at, these are two men. These men were the same age when they died. They were the same size when they died. And they actually had the same measurement around their skull when they died. So what should we see? Same size brain. This gentleman died in an accident with an absolutely healthy brain. This gentleman died after living 10 years with Alzheimer's. Alzheimer's disease is not a memory problem, it's brain failure. it's actually destroying your brain. By the end of this disease, put up 3 fingers, these 3. You will only have 1/3 of your brain left. Put up 3. This is you. This is the person you're trying to help at the end of the disease. They are working with 1/3 the brain that you have. They are doing the absolute best they can do with what they have left. They aren't being ornery. They aren't being stubborn. They're not trying. They're in brain failure, just like any other organ failure. But because we can't see this, I truly think if you could see their head shrink, like their brain shrink, if their head shrank, your brain would be much more accepting because you'd be getting a visual cue. When you looked at their head, you'd go, oh my God, their head is 1/3 its original size. Of course they can't do this. The problem is that's not what happens. Their skull stays solid, but what's happening inside the skull is their brain is literally shrinking. Now, when that happens, I want to show you something. Take your brain and put it inside your skull. This is how your brain fits inside your skull. Now, take your skull and fall forward and hit the floor. What is the skull doing to your brain? Protecting it. Unless you fall really hard or really fast, this skull actually protects it. When you have dementia, late stage dementia, pull your fist back approximately 1 inch from the skull. This is how much shrinkage there is. This is how much space there is between the front of your brain and the skull. Now, fall forward. You end up with a contracture head injury because what happens is the brain slams into the front of the skull and bounces to the back because what's in the space here is fluid, really thin fluid. And so a simple fall from a chair can result in a significant outcome for somebody in late stage dementia because there's so much free play in here. And that's where it's really, really important. We're paying attention to what's going on because the person with dementia is going to make mistakes. They're sitting like this. One leg is crossed over, the arms are pulled in. Why is that happening? Because the motor strip is dying and the muscles are turned on. They notice something down there to pick up, except all it is a carpet pattern. But they don't know that. They think it's a thing to be picked up. Here's the problem. What did I do? I could not do it. I put my foot out to save myself. It's a protective response. They don't have that. And so they fall forward. They don't even have time to turn their faces. And so they crack right in the front. They break their nose. They break their cheek. And it happened that quick. But what if you had me sitting at a table? Would that have happened? No, why not? Because I wouldn't have seen the thing to try to pick up on the floor. Who's going to have that big picture, take a look, understand the world from my perspective? You, because I can't do it anymore.
So that's one of the things that makes caring for someone with dementia or Alzheimer's dementia so challenging. There is such a change within the brain itself, how we process information, what we can see and how we interpret what we see. I am obsessed with this video right about now because it explains so much what actually happens to the brain and the reason behind the behaviors that we see, because the brain is changing, it's slowly dying, and the way we process the world around us, how we see things, how we move, everything is changed and affected by dementia and Alzheimer's. And, how do we know how to provide care for someone with Alzheimer's or dementia without engaging with enough education and enough information so that we are armed with the tools that we need to provide the care that our loved one now requires. So this is just one example, and if Jennifer lets me do another presentation on this, I promise to move on to something other than Tifa Snow, but I'm a little bit obsessed right now because she's fantastic. But It's all good. So does anybody have any questions about Truealta, or are there any questions for me so far as what I can assist with based off of doing caregiver interventions and things like that? I don't know, Jennifer, did I even say anything about that last time, or did I just go over Truealta?
I don't think you did. I think you stuck to the script last time.
I didn't write a script this time, so I'm sorry.
Sounds good. Well, that's great information. And for many of our clients on both PANDA and the Alabama Cares program, you've probably heard us talk about Tifa Snow. And really, I mean, she's world renowned, probably one of the most layman termed individuals, but also one of the most intelligent people when it comes to Alzheimer's and dementia. And she really does a great job of making it personable for people. So we do encourage you. We're not endorsed by her. We're not associated with her at all, of course, but she has a plethora of videos on their social media accounts as well as YouTube. It seems like 10 times a day or more, they're going live on her Facebook page doing caregiver trainings and discussions. So be sure to check that out. That's free as well. So it's definitely a great resource during these times. So Crystal, did you have anything else you wanted to add, or do you want us to move on?
I think I'm good unless I forgot anything. Jennifer, did I forget anything?
I don't know if Jennifer's trying to talk, you muted. So it sounded good to me. I think we're good on, if you're good. We've got about 15 minutes here, so we'll move on. If you have any questions for Crystal, the same, be sure to add any of those comments on the Facebook page as well as the chat window in the Q&A session, and we will be sure to mention those before we get to the end, or respond to you on either the social media, or if you email us, respond there as well. So I'm going to go ahead and try to share my screen again here. And we're going to move on. Crystal, do you guys see that? The logo?
Oh, you could hear me if I unmuted myself. Yes, we can see the logo.
Okay, great. All right. So for those of you who are joining us for the first time or need to be reminded of who M4A is, of course, we are the Middle Alabama Area Agency on Aging, also known as M4A. We're one of 13 area agencies on aging that cover all 67 counties across the state of Alabama. You see there we're in the central region, and we pretty much cover the county surrounding Jefferson County, but there is an agency in Jefferson County that covers that large demographic area. So if you contact our agency, of course, if you've called us and you're calling from another area, and vice versa with other area agencies on aging, to where you're trying to get a hold of us, we're all interconnected, and we can certainly get you to the right location that covers your region. Our mission overall for M4A is that we empower individuals, people living with disabilities, and their caregivers to self-advocate as well as live independently and safely in the communities of their choice. Our agency's motto, simply put, is assisting all ages at all stages. We cover Blount, Chilton, St. Clair, Shelby, and Walker counties. And for our senior employment program, we additionally cover Jefferson County as well. So how it all starts for us is we have an Aging and Disability Resource Center, also known as ADRC, that serves as a single point entry for resources into the community. You call us, we get you screened for those benefits, and they make referrals to the appropriate programs. Of course, with everything that's going on right now with the COVID pandemic, we've seen an enormous amount of calls and referrals being made. So things are pretty busy right now, for sure, to say the least. But ongoing, that's kind of the traditional way of doing things. Is we have people that come to our office physically as well as call in, but we also have a online referral that we'll go over in just a few minutes. But feel free to call us. The standard number there that you see, the 1-800-AGE line, that will connect you to your local area agency on aging based on your phone number. But again, if you get connected to the wrong agency, they can certainly connect you back to the correct department or agency that covers your service area. Some of our key programs that are covered across the state, of course, we do an elderly nutrition program, both on home delivered meals, as well as we partner with really all of the senior centers for our region to provide meals through the senior center, both hot and frozen, like I said, with the delivery system. But that is something that's offered across the state. We also have caregiver supportive services like our Alabama Cares and our Panda project, which we went over earlier. We have a senior RX program that helps with medication assistance for those that are in the gap period or have lost coverage of somewhere of another. They can help work directly with the manufacturers to get low cost or no cost drugs to help kind of ease that burden financially for not necessarily just caregivers, but also individuals in the community as a whole. We also have insurance counseling, which we will be joined by our expert SHIP counselor in the next month or two once we get closer to our open enrollment for Medicare plans, because as you know that there's a open enrollment a couple of months out of the year that you can look at your insurance plan, your Medicare plans, to see if there's a better option available for you out there. But of course, if you have questions about that any time of the year, you can always contact our agencies. There's Medicare savings plans that she works to get individuals on to help save costs on medications, as well as any copays and Part B premiums, for example. So feel free to call in if you're having any insurance issues, specifically with Medicare or Medicaid. And we also, again, we have a senior employment program called CSEP, which we partner with host agencies across the 6-county region for that, including the Jefferson County region, where we partner with nonprofit agencies to provide a workplace for individuals who are looking to get back into the workforce. And it's something that we provide as part of our mission and our funding with that program. We pay for the service hours that our participants attain there. So that's a great program, especially if you're a nonprofit looking for, in a sense, free labor, and it's really helping those individuals learn a new skill or a new trade, and to really hopefully sustain long-term employment. That's the ultimate goal there. We also have legal assistance that we partner with an elder law attorney, and she helps to provide legal guidance to individuals who are especially 60 and older, but we also try our best to help with individuals under the age of 60. So please don't hesitate if you have any questions to let us know, because if she can't help you, she can get you in contact with an agency or agencies in plural that can. So always try to reach out. We also have elder abuse prevention or elder justice. We have ongoing different workshops and training events. And of course, by nature, we are elder abuse prevention advocates. So we always have that in the forefront. We do have a new initiative that we've started, which I have a flyer at the end of this presentation to kind of review over, to show you some of the things that we have going and opportunities that we have. And we also have long-term care supportive services for those not only in the community, but also in nursing home facilities. Of course, our Medicaid waiver program is our big program here, really across the state, that provides in-home services to eligible individuals, both physically and financially, to prevent long-term care placement and to help keep the family member or the individual in the community versus going to a long-term care facility prematurely. If there is a situation where you have someone who's in a long-term care facility, or they're looking to come home, or whatever the situation is, we do have a local ombudsman who can speak on behalf of the resident, and he's kind of actually there's two of them, he and she. They will speak on behalf of both the family and kind of be the middleman for the facility and the family to kind of help solve the situation that needs to be taken care of there. So going back to our referral process, we do, of course, have the traditional call-in method where you can call or walk in to find out what you might be eligible for, to get on what we call as a callback list, to get that full benefit screening. But we also have an online portal now that you can actually, as a professional, as a family member, as a friend, as yourself, you can go on and you just go to www.m4a.org/referral. And once you do that, you'll be prompted with a couple of screens. Actually, it's one really long screen, but for me, it's two screens because it was so big. Excuse me, but you can plug in your information here, the services that you're interested in, the individual that you're making this on behalf of, as well as any other additional notes. And you can send this to our queue to basically do the same thing as walking in or calling to get back on that callback list. So, providing as much information on this as possible really makes that callback and that full benefit screening as seamless as possible. So feel free to check that out and share that with anybody that you think might benefit This is our social media accounts. We're a little bit more active on some than we are the others. Primarily our Facebook account is really our big one. We try to share things and do stuff on our Instagram and our Twitter accounts as well. All of our videos that we record through our Zoom feed, we try to record those and put them on our YouTube channel so that you can refer back to them, whether it be this year, whether it be next year, and share it with anybody. It just makes it a little bit easier to do that. So be sure to check those out, as well as joining our newsletter. When you go to our website, www.m4a.org, you'll be prompted to join our newsletter. And Robin James, our marketing director, does a wonderful job of just getting all kinds of events in the community into our newsletter so that those that are on our newsletter list can really be connected to those things that are happening out in our communities. We do have our next coffee break scheduled. I believe this is correct. 2 weeks from today. I'm going to check my calendar, make sure I didn't make a typo. Let's see. That is the 26th. That is correct. For 2 weeks from today, from 1 to 2, the same place. We will be posting this on our again, our Facebook account. So we have a Panda page on our Facebook. We have an M4A Facebook page, as well as we now have an Alabama Cares page. So we put these events on our primarily on our Panda Facebook page, but our other programs do share these. So feel free to go ahead. It'll have the RSVP link in there, and also kind of a short description on the next guest speakers, who will be Miss Janice Hall and Danny Reams, who are with the Extension Office, and they're going to be talking about canning. So I'm pretty excited about this because I have not eaten lunch today, and both of those pictures look excellent. So I'm really excited about this, and I know you will be too. Again, Coffee Break is not only filled with education about things that are happening, current trends or emergency preparedness or whatever we decide to talk on. We try to mix it up. So we're going from Alzheimer's education and legislation straight to canning. So we hope that you'll join us for that, because it's sure to be a treat, no pun intended. This is the event that I wanted to kind of talk about with our Elder Abuse Prevention Initiative. We have a new initiative that we're doing. Is called Take a Stand for Caregivers. And this kind of goes in line with that, not only just elder abuse prevention, but also just information for caregivers, trying to equip them with tools to really try to equip them with any kind of situation that comes to their door. Specifically with this lesson will be on managing your medication, and an overview of our Senior RX program, which is again the program that helps with any type of medication for those that may have a high premium, or not a high premium, but they've lost coverage, or maybe their plan doesn't cover specific medications. So tune in for that. If you have nothing going on, that will be next Wednesday, August the 19th, from 10 a.m. to 11:30, and it will be on Zoom as well. We do have this on our Facebook page, I believe, under our events. If we don't, we will have that up soon. So feel free to go ahead and click that you're interested in that, so that you'll be made aware once that goes live, and kind of give you any updates. So our contact information for M4A, our physical location is 209 Cloverdale Circle, Alabaster, Alabama, 35001. You can mail us at P.O. Drawer 618, Saginaw, Alabama, 35137. And of course, there's our phone numbers, both local and toll free. But the easiest way really to get the information readily available is through our website at www.m4a.org. And I don't see any other additional questions. So if you have anything that you think about while you're watching this later on, feel free to really engage with us, whether it be either Lisa with Alzheimer's Association or with any of our staff members at M4A. Feel free to reach out to either of us. Again, her email is lholman, LHOLMAN @alz.org. So feel free to reach out to her and their organization, as well as M4A, to see about anything that we might be able to help you with. If you have an event that needs to be promoted, or if you have any other question, feel free to reach out, and we'll do our best to get that information back to you. So we thank you again for joining us, and we look forward to the canning session in 2 weeks. And if we don't speak to any of you again, have a safe weekend or rest of your week and weekend. And things still seem to be kind of crazy out there in the world. So try to do your best to stay safe and practice great hygiene. So we'll see you guys next time. Have a great rest of your evening.
Thank you.